What are the risk factors for stroke? Anyone can have a stroke at any age, but certain things that can increase your chances of having a stroke. While you cannot control your age or family history, you can take steps to lower your chances of having a stroke. Many common medical conditions can increase your chances of having a stroke. Previous stroke or transient ischemic attack. If you have already had a stroke or a transient ischemic attack, also known as a mini stroke, your chances of having another stroke are higher. High blood pressure. High blood pressure is a leading cause of stroke. It occurs when the pressure of the blood in your arteries and other blood vessels is too high. High cholesterol. Cholesterol is a waxy, fat-like substance made by the liver or found in the certain foods. Heart disease. Common heart disorders can increase your risk of stroke. For example, coronary artery disease increases your risk for stroke because plaque builds up in the arteries and block the flow of oxygen-rich blood to the brain. Other heart conditions such as heart valve defects, irregular heartbeat including atrial fibrillation, and enlarged heart chambers can cause blood clots that may break loose and cause a stroke. Diabetes increases your risk for stroke. Obesity. Obesity is excess body fat. Obesity can also lead to a high blood pressure and diabetes. Sickle cell disease is a blood disorder linked to ischemic stroke. A stroke can happen if sickle cells get stuck in a blood vessel and block the flow of the blood to the brain. Your lifestyle choices can increase your risk for stroke. The healthy behaviors can lower your risk for stroke. Getting too much salt in the diet can raise blood pressure levels. Not getting enough physical activity that can raise the risk for stroke. Drinking too much alcohol can raise blood pressure levels and the risk for stroke. Tobacco use increases the risk for stroke. Age and sex. Stroke is more common in women than men, and women of all ages are more likely than men to die from stroke. Genetic and family history, and pregnancy and use of birth control pills. Please watch next video for what are the tests and treatment of stroke.